March is National Colorectal Cancer Awareness Month. We are bringing on Dr. Lynn O'Connor, who practices in the New York area. Lynn works a lot of hours. She works many hours treating clients, patients. So we are so appreciative that you took the time to spend with your Facebook audience today to answer some of these questions that people may have.
Absolutely. This is a very important topic, and it's Colorectal Cancer Awareness Month. It's March, so we have to get the message out. So it's absolutely important to be here. Thank you for having me.
Oh, I really appreciate this. So I'm gonna start off by asking you some questions that that I see on your page. First, Lynn, can we talk about the basics of how long have you been practicing and what started your desire, the drive to be a cancer surgeon?
Oh, I've been practicing I've been in the Long Island area for 12 years. I've been practicing far longer than that. I've always had an interest in preventative medicine, global public health type of awareness, and looking at, I wanted to just specialize in one area, and that was the colorectal cancer and colorectal surgery. And this is the one area where if you can actually do just a few things of eating right, exercising, getting screening, this is a cancer that can be prevented. And this is a cancer that even if it is detected, if you do those things, you can detect it early, and it's something that's curable. This is the type of cancer that we can actually beat and we can get a hold of. So, having that opportunity to intervene in an early time frame and affect cure was really very attractive to me to be able to help people.
Good. And all right, so let's talk about that. You said about prevention, etc. So first, let's start with this, because these numbers are changing. You have told me that this used to be an older person's disease, but now who is most at risk? Talk about also, has that changed in the last couple of years? All right, so who's most at risk? Who at home right now might need to check to see, if who's most at risk?
Well, actually, what you have to look at, the average risk patient that we try to tell people about colon cancer screening is if you're Caucasian, 50 years of age. The average risk individual, 75% of people who develop colorectal cancer are average risk patients. So we're talking about 50 years of age is when you should start screening. Now, if you're African American, Hispanic, Pacific Islander, you should start screening at age 45. Reason is stage for stage, demographic will present with more advanced stages. Why? We're not exactly sure. It could be socioeconomic status. It could be lifestyle, diet. All those types of things may cause people to present earlier with that type of disease. It's important also to understand that if you have symptoms, if you have rectal bleeding, if you have rectal pain, if you have change in bowel habits, if you have weight loss, some of those are reasons for you to get screened immediately and see your doctor. So we're actually seeing disturbing amounts of younger patients in their 30s and 40s presenting with higher rates of colon and rectal cancer. Why? We're not sure, but it could be simply diet. It could be we have a lot more genetically modified organisms that we're eating. There are a lot more pesticides and antibiotics in our food. We're a lot more sedentary. So those are some of the reasons why we may be seeing higher rates in younger patients. But on average, at age 50, for Caucasians, you need to start screening right then and there. And if you're African American, you need to start at 45.
So what you're seeing is more numbers of younger patients.
Yes. It's disturbing.
Higher numbers.
Yes, we're seeing higher numbers of younger patients who you wouldn't even think would have colon cancer. And when they are presenting with colon cancer, unfortunately, it's pretty well advanced. So that's why it's important to speak with your family as well, because family history is important. A lot of times we're spread out nowadays. So you have immediate family one place, and then you have distant family somewhere else. We are not talking about our family history. We don't know if grandma had colon cancer, your parents, you don't even know if your parents had colonoscopies, and if they're screened and they have polyps. So it's really important to start that conversation and to start asking about your family history and what family members have had. It's really something that we need that conversation needs to start happening. It needs to start happening now.
Yeah, good point. If you only see your family at, Easter and Christmas, it's not like you're sitting down and saying, "So, who's had a colonoscopy lately?"
Exactly. That's not exactly
Another
coffee
reason to
table
call your
discussion.
mother more often.
So yeah, it's really important to make sure that these conversations are had, because you don't know. Plenty of times, I have family members who come in and they really don't know their family history, and especially if you're adopted or if you're estranged or you don't have that information and you are having signs and symptoms such as what I discussed earlier, you should see your physician, and a screening colonoscopy may be in order.
Okay. Now, you mentioned a couple of the warning signs, so let's talk about a couple more. Because you said rectal bleeding.
Yeah.
What are some other warning signs?
Well, a lot of people have rectal bleeding and they think it's just simply hemorrhoids, or they think it's just simply, they have wiped too hard. I remember I had a 35-year-old in my office who came in because he had a little bit of rectal bleeding here and there. He thought it was his hemorrhoids. His wife actually made him come in. And I started speaking to him more and more and getting a little bit more information out, teasing it out. Turns out his father had colon cancer. At 35, I said, listen, you need to have a colonoscopy. He didn't think he needed one. Turns out he had a colon cancer. He had a right-sided colon cancer, and that was a huge save. So if you start having issues such as rectal bleeding, such as changing your bowel habits in terms of the size, pencil thin stools. Before you were having normal regular form stools, they're loose, they're more frequent, the size to change, the color change, any of the characteristics that are changing is something that you should be concerned about, and it's something that you should talk with your physician about. People have change in their diet, they have change in their appetite, they're losing weight, and sometimes those symptoms mean you're a little too far gone. The whole purpose of colon cancer screening is to make sure that you get to the problems or remove the polyps before you actually start having symptoms.
Okay, so the 35-year-old, he had some rectal bleeding. He didn't think it was a big deal. He comes in. He had hereditary. He had a father who had it. You were able to just cut it out and boom, he's cured?
He's good. Yeah, he's absolutely good. We got it early enough where it had not spread, and he was able to have a simple resection. He was back to work in 6 weeks, and he's doing fine.
Oh, that's great. You saved another life. And his wife did a great job too, because his wife was probably nagging him.
Exactly.
And finally he came in, he talked to you. Like you said, you had to pull out that information, but then you were able to save a life.
Yeah, and it's really gratifying to be able to do that. And now he knows to let his brothers, his sisters, and his family members know they need to come in and they need to get screened as well too.
Wonderful. Nice job, doctor. Nice job. Good save on that. All right. So obviously, when should you see a doctor like you is when you're having this kind of rectal bleeding. What else? What are other times that you would suggest, you should come in to see me?
Well, obviously, you need to come in to see me just for regular routine screening. So if you're 50 years of age, that's the time you need to come in. If you're African American, Pacific Islander, you need to come in at like 45 years of age. If you're having any symptoms, such as like the rectal bleeding, the pain, the change in bowel habits. A lot of people are like, I just want to know. If there's something that's not right, if you're feeling something that's wrong, that's changed, you have some symptoms, you need to come in and be seen. It doesn't necessarily mean you need a colonoscopy right then and there, but you need to be seen. There has to be some reason for that change, and we need to be able to examine and find out what it is.
Okay, now if that 35-year-old, here's an example. Somebody at home, they're watching this.
Yes.
You say the rule is if they're Black or Hispanic, it's 45, Caucasian is 50. But if you already know that you have a family history, should you come in before you start even seeing symptoms?
Well, it depends on the age of the family history. So in essence, if you had a first-degree relative, such as your mother, such as your father, a sibling who had a colon cancer at 45 years of age, you need to start screening 10 years prior to when that colon cancer was diagnosed. So at 35 years of age, that's when they need to come in. Very few people have those quote unquote actual hereditary types of colon cancers. The majority of colon cancers we see are sporadic, meaning they just happen, it's average risk. But when you have multiple family members over multiple generations having colon cancers or rectal cancers, that should say, ring a bell that we may have a family history here. We may have a hereditary problem. So it's really important when you see a physician to give that information, to give that family history, and they need to elicit that information from the patient.
Excellent, thank you. All right, okay, here's something, you talked about people being younger now having having colon rectal cancers. So obviously that may mean there are things we can do to prevent it. So if someone's at home right now and they're watching this and they even have hereditary issues, what can we all do to prevent this cancer?
Well, the first thing is, if you know your family history, that's key. Start talking to your family, start talking to your mom, your dad, your grandparents, anyone that may have any indication of your family history. That's first. So you know your history. The second thing is a lot of times just exercising, just simply getting off the couch, walking 30 minutes a day, lifting, doing light, heavy weights, exercising, eating right, getting enough sleep, reducing stress. Those are the things that are going to really help make your overall improve your overall health. You want to try and limit the nitrites, those high sodium foods, high fat diets. Smoking is an absolute no at all times. And drinking in moderation. For women, usually 1 drink per night if you're going to have that. Men, 2 drinks. And those are the things that are going to really help prevent a lot of the illness we see, not even just cancer, high blood pressure, heart attack, stroke, heart disease, all of those things. If you can adopt a healthier way of living and a healthier lifestyle, that's going to make the big difference.
Okay, and you know what? If anyone at home is going, gosh, it's a lot of stuff, I gotta look up these things, I will say what's interesting is, like you mentioned one specific ingredient, nitrates. Nitrates is added to a lot of deli meats, your bacons, your hot dogs, and someone might go, well, I really like my deli meats, or I really like my bacon. Every grocery store now offers an option without nitrates.
Yes, there's a nitrate-free option. Absolutely. There's a low sodium option. Absolutely. And what I'm trying to say is everything has to really be in moderation. So if you're having a big dinner or you're having a brunch, you have a slice of bacon here or there, that's fine. Everything in moderation. I mean, nobody's going to live a Spartan lifestyle and not ever have a drink or pick up a piece of cake. But it's really just moderation. And if you balance that moderation and a good diet with high fiber, fruits, vegetables, eating right, exercise, enough rest, that should be what's going to really help you maintain a healthy lifestyle and a good diet.
Absolutely. All right. And so here, let me just to make sure, and I know that you can't actually diagnose and you cannot prescribe anything on your Facebook page or anything like that. But if somebody has a specific question and they want to be able to at least reach out to you or make an appointment at your office, how can they reach you? Should they email you through your website at lynnoconnor.md.com?
They can absolutely email me at my website, lynnoconnor.md.com. I work with Pro Healthcare Associates. I have 2 offices. One in New Hyde Park, Lake Success, that's 3 Vermont Drive, Lake Success, New York. And I also have an office in Huntington, 200 West Carver Street. So I try to be as accessible as possible. I have patients coming from all 5 boroughs. I have patients who actually come from New York, from New Jersey, Pennsylvania, and California to come back and see me. So I operate at multiple hospitals. I really try to be as accessible as possible. People can reach me via Facebook. They can reach me via my office. My number is 516-608-6848. That's the Lake Success office. And my number is 631-423-5070 in my Huntington office. You can follow me on Facebook, reach me on Twitter, LinkedIn. I try to be as accessible as possible because this is really important. This is an important topic, and it's an important time, and we really need to take charge of our health.
Absolutely. And I think months like this, when a government will dedicate a month like March to National Colorectal Cancer Awareness, this does help it get in somebody's head. They'll see it on the news or see it right now on Facebook Live, and they'll go, oh, you know what? I have had stool changes. Or maybe that is not just really harsh toilet paper. Maybe I need to check that out, that rectal bleeding. So I really hope that somebody saw this and starts at least a conversation and asks, what did grandma die of?
You know, you would be surprised because I had one patient just simply mention to their coworker that they were having rectal bleeding and they were having problems. And then they mentioned that to another coworker. And come to find out, when the three of them actually started talking, they all saw me. They were all my patients, but they didn't know. So, you know, this is not the average conversation that people have. It's not very easy to have this conversation, but it's a conversation that needs to be to have. And you need to talk about this with your family. You need to talk about it with your friends. You need to talk about it with your colleagues. You know, I have people who grab their best friend and they come and get their colonoscopies together. I have sisters who come get their colonoscopies together. Husband and wives come get their colonoscopies together. You know, you can make a day of it. It's not the most wonderful, glamorous thing, but it's life-saving. And it's something that's really, really important. And if you demystify it and take away the fear and the anxiety surrounding that, then people will do it. A lot of people are concerned about the prep. We have totally new preps that taste better. They're not as harsh on the stomach. You can get them down and you can get through it. And the anesthesia is the best part. You get a good nap. So, you know, it's a procedure that we all really need to do, just like screening for breast cancer and screening for cervical cancer and screening for prostate cancer. We can screen for colon cancer, and this is a cancer that we can beat. This is a cancer that we can cure. We can get those rates down, but we need to be proactive in our own right. We need to ask the questions. We need to alert our doctors. We need to sometimes educate our doctors that, hey, I need a colonoscopy.
Yes, ma'am. Well, thank you, Dr. O'Connor. I love working with you. I learn something new every day, every week. And thanks for thanks for helping all the people who have come into your office. And truly, you know, moms and dads, you know, are able to spend 50 more years with their kids because they came and saw you. So,
welcome. You're more than welcome. This is important. And anything
thanks for spending time with us
to get this message out. I definitely will. You got it.